no longer available after 5 p.m. today. So depending on the length of public comment that we do have, if we get to that point, then we will likely suspend proceedings until the next regular scheduled meeting, or unless we can come up with a special meeting prior. So everybody's aware that's the procedure that we need to follow. So we will again remind individuals that there is a 3-minute limit. I have been trying to allow people to wrap their statement at the 3 minutes. Some people have respected that, some people have not. Online, we will be cutting them off if in fact they go past that second reminder that their 3 minutes is up. They will be muted and we'll be moving on to the next participant. If you have spoken in person, you do not have the opportunity to address the board again online. If you so choose to address the board online, please be respectful. This is an address to the board, not to individuals. I think I hit all the points so far, and I'm going to pass it over to our tech.
So as a reminder for those who are on Zoom, probably the best way to get your name on the list to get your turn, I would recommend using the raise hand feature. That way it gets up higher on my list. And once it's your turn, then I will click on you and I will ask you to unmute your audio. And you should get a notification to turn your audio on. And then at that point, when it is time for your public comment to be over, then I will be the one muting so that the next person can have their turn so we can keep this moving forward.
If you don't have a public comment, if you wish to say no comment, that's fine too. Then we can move forward a little bit earlier. If we're taking a minute to allow people to get them unmuted. So there will be multiple, again, asking for the name. I believe 3 times was inappropriate to allow for them to unmute and respond. But if in fact you have no comment, you're welcome to say no comment and mute yourself again.
Currently, we have 5 who have raised their hands. The first one is Rachel Prino. I'm going to ask to unmute now. Hello, yes, we can hear you.
I believe she's being telecasted out in the hallway, but not in the room. You give it just a minute, Rachel. I apologize. We can't hear anything in this room.
Is that that?
We had it for a second.
Yeah, I'm not doing anything to.
All right, let's try this. I agree.
There's a delay.
Technology is challenging.
Zoom assistant.
Is there anybody on the side here still? Is there anything?
All right. There's no light. Rachel, I can see you. Can you say one more thing, please?
One more thing.
There we go.
There we go.
Now start.
Okay. you're ready.
Yeah, Chief
Can we bring the speaker in here?
Medical Officer that I will be sharing. Is that working well for everyone there?
Outside is turned off.
No.
It's not running, it's somebody else's.
Hang in there, we're working on it.
What about bringing the speaker in here?
I think it would feedback through all these mics.
Oh.
Network bandwidth has no.
Yeah, the internet is now. It's on there.
Can they be directed to submit their comments to the health department website like the other ones? We're not even
They
there.
want the opportunity to speak, that's given that opportunity. I understand,
Yeah.
I'm trying to be fair.
No, I get it. I'm not contesting that. I'm saying if that's not an option.
I'm trying to figure out where. It's really as an internet lag to this. So when you hear it, it's just not responding.
Put on right next to it.
Possible.
Yeah, there's a delay.
Okay, Rachel, can you try again?
You could try another person and see if it's just her.
I gotta do this.
Rachel, can you try again?
I'd be glad to.
That sounds good.
So it looks like I will be able to not hear you, but I can speak. Is that correct? Okay, thank you. All right, so I have a letter from Dr. Lawrence Young. He's our Chief Medical Officer and a family physician here at East Jordan Family Health Center. And I'm reading on his behalf as he is with patients today. As the Chief Medical Officer and practicing family physician at the East Jordan Family Health Center, I feel I need to voice the support for the decision taken by the Health Department of Northwest Michigan in requiring masks be worn by students when indoors or in high contact sports. community members. I am sure the decision to require masks was not made in haste and was not made to take away any rights or privileges, but to protect those whom these be taught have sworn to help. Wearing masks, practicing proper social distancing and hand washing, along with immunizations are all proven mitigation strategies that reduce transmission of any airborne virus. We are fortunate that SARS-CoV-2 or COVID-19 is more easily transmittable, or we would likely have a much higher mortality rate. As it is, the current Delta strain is much more highly transmissible than the previous version. It is deadly to the immunocompromised population. Masks are a necessary barrier to prevent the transmission of the virus and offers some protection to the person wearing the mask as well. We know through recent studies that countries that had robust masking did much better with preventing virus transmission, along with the death and disability rates in the population. If you aren't afraid of the virus, you should be. It deserves to be taken very seriously. It is a top 10 cause of death over the past 18 months within the United States. If we have the power, and we do, to reduce death and suffering from the virus in both the short and long term, we should use every tool at our disposal to prevent infection. During the flu pandemic of 1918 to 1920, we did not have vaccines that are 94% effective in blocking severe complications and death. We did not have as much understanding about infectious diseases, how they spread, how they attack the body, and how they perpetuate and reproduce and mutate. We did not have the knowledge nor the ability to treat complications that we have today. What continues is the head in the sand response to the virus, the wish that it will eventually go away, and the vilification of experts in the field. We are fighting a war with COVID-19 in this pandemic. We should be fighting the virus, not arguing about masks that are proven disease prevention methods. Wearing our experience.
Oh, we're gonna let her finish all the way through?
In the partisan fighting, Doris Young, CMO, and from East Orange Family Health Center. Thank you.
As stated previously, you were given the courtesy if you spoke to.
Not everybody
concluding statement. Your 3 minutes were given. Your timer went off. By the time she said time's up second, I interrupted. I did it for everybody. So we're trying to be courteous to everybody.
Okay. Next on the list is Sally Kramer. I'm going to ask you on mute now.
Can you hear me? Okay, I see that. I can see you now. My name's Sally Kramer. I live in the East Jordan School District. Just a second, honey. Okay, just a minute, sweetheart. And I don't have a lot of good privacy. Sorry about that. I felt that there was only one specific comment that could be made that hasn't already been addressed already. I'm disabled, and I have children with disabilities. And I don't feel like I have many options outside of homeschooling at this point, because there is no possible way to fulfill my children's IEPs or 504 plans and have them get the education that would make their education equal to their peers with the way the mask mandates have worked. I know myself also struggle with my own disabilities. I require reading lips to understand when people are speaking to me. It has more to do with the brain injury than with actually being able to hear. And this entire world has put us into a point where we are incredibly isolated. The mask mandates prove a lot more problems than they are fixing, I think, at this point. Be patient, sweetheart. I can't imagine how these masks are actually helping, when every time we try to utilize masks, we end up with more problems. There are things, I have an infection on my face from having to wear masks just to go to the hospital, let alone expecting my kids to wear a mask for their entire school day. And so we homeschool now. I really hope to send them back. I mean, homeschool because I'm not going to trade my, I can't think of the word, bear with me. I'm not going to be uncomfortable while making, with trying to figure out how to homeschool or choose to just make my kids suffer, because wearing the masks makes my children suffer. Being around all of their friends wearing masks makes my children suffer. It's the only thing that hasn't been said already. Thank you.
Next, we have Gary Boss.
Hello, yes. Hello? Oh. Can you hear me now? Oh, can you hear me? I hope you can hear me now.
Yes, we can.
Thank you. Yes, my name is Gary Boss. Thank you, sir. I live in Boyne City, Michigan. I'm the proud mom of 3 girls that went through a charter school here in Boyne and had a great education. I'm now a grandmother, and I have grandchildren who are just coming up to school age. One of them is compromised medically, and what they have to do when they have trips down to UM or whatever coming up is they have to put her in a bubble for a while and separate her from opportunities where she might catch something. And down so that that one child could be in the school building. It does sense. It's not logical. In personal health and rights is just, first of all, morally wrong, and maybe more importantly, it is legally wrong, and I don't support that. I did put into the chat a list of studies and research from valid medical resources that show that masks efficacy in stopping the transmission in the way that this particular board believes it does is not proven. And though I respect the doctors who have stepped forward today to say they do support wearing these paper masks as a way of controlling, containing, or mitigating in any fashion the transmission of the COVID China virus, I don't believe that the research actually backs their opinions on those matters. In fact, when the head guy in the United States has bounced from no masks to 1 mask to 2 masks to 3 masks, and no only N95 masks. Well, no, it really does mean that we have to individually look at the research that's out there. And so I just ask those making decisions today to please recognize that we have rights, we have constitutional rights. We have rights regarding our go to. and that this issue covers a lot of, it covers a lot of territory for a lot of people, and you be making decisions. And I'm gonna just stop today. The issues behind this mask mandate are much bigger than the paper masks and little paper flags that are being waved. And so I beg you, I implore you, I ask you to please preserve our rights, preserve our legal rights as human souls to choose what's best for us and our children. And please remove the mandate. Thank you. Thank you for the opportunity to speak today.
Next will be Candace Weirs. Trying to get her up.
Okay. Thumbs up. Can you hear me? A thumbs up by anyone? Okay, I got it. All right. My name is Candace Weirs, and I'm a resident of Charlevoix Township, along with my husband and 3 daughters, ages 12 and under. My daughters were able to listen in on some of this meeting, and I'm so discouraged by the lack of civility that they witnessed. As a community, we are better than this. I'm writing in support of the public health order issued on August 27th. I'm beyond grateful for Ms. Peacock and Dr. Meyerson putting the health of our local communities first to implement universal masking for the upcoming school year. It seems logical that they would be the ones to make this high-stakes decision, as they have the credentials and expertise versus a school board made up of members from varied backgrounds that may or may not include a health background. Our community has the advantage of starting later than other schools, so we can look at the data regarding those schools that already opened for the fall and chose not to mandate masking. As you probably heard on the news, many schools across the country that started without a mask mandate had to end up closing due to the high number of children infected or having to quarantine, and then ended up instituting a mask policy upon reopening. Do we want to be proactive? Negligent. As a healthcare professional, I do not want my kids to be the reason I unknowingly spread the virus to my patients who may be in their 90s, 84-year-old grandma who I enjoy visiting in her nursing home. We as parents are role models, and how we feel about masking seems to have an effect on how our children feel about masking, which became very evident today. There doesn't seem to be agreement if masks are harmful. Overall, what is the harm in starting with a universal masking mandate and possibly loosening restrictions based on the numbers as the school year progresses? I know we all want this pandemic to be behind us, but it isn't, and ignoring guidance from these officials with the knowledge and expertise could have devastating consequences. What kind of community have we become when we don't care about our most vulnerable children and adults? Thank you.
Thank you. Next on our list is Ashley Vandenberg.
Hello, my name is Amber. I have 3 children in the Gaelic School District, and my degree is in clinical laboratory science. Until last fall, I was a clinical supervisor in a local hospital laboratory. It was my job to bring on board and validate the COVID testing. I can tell you the tests are not being utilized in the manner they were designed to be used, and we did not follow standard scientific procedure when validating them. I actually left my position with the hospital because I feel so strongly about how we mismanaged this virus. My youngest is 4 in cancer remission, so I feel I also have a good handle on what it feels like to be protecting immunocompromised people. For years he was on chemo and radiation, we hid it. In our home, we hid it. We protected him, we practiced healthy habits to build our immune systems. We did not ask the whole world to stay home too. When he was done with treatment, we had to force ourselves to go back to normal, to let him and his siblings live life and get dirty. Because a lot of cancer kids relapse with leukemia down the road because their immune systems have been so messed up by living in the bubble. We need germs to be healthy. Right now, the majority of this world is stuck essentially in a chemo bubble. It's not healthy. The long-term effects of sheltering these children and forcing them to do things that are unhealthy is scary. The fact that we are forcing them to do things based on case numbers from tests with alarming false positive rates when actual science says masks don't work is child abuse. And those mandating it should be ashamed of themselves. Thank you.
Okay, next on the list is Perry Irish Hodgson.
Hi everyone, can you hear me okay?
Yes, we can.
Thank you. My name is Perry Irish Hodgson. My husband and son and I live in Charlevoix, and our sons attend Charlevoix Public Schools. I support Dr. Meyerson and Ms. Peacock. I have written emails of support to the community commissioners and the health department. I know your meeting today has been crowded with vocal opponents to the mask mandate, and I've been so disappointed to see that. However, I know that those present at this meeting today not define the entire community. I have heard so much misinformation today, much of it from people who have done their own research. I would encourage all of us, those who guide us, who have done many, many years of schooling and had practical experience, where it belongs, the people who went to school for it, and can continue to educate the rest of us. Again, I support the recent order, and I want to thank you for taking the time to listen today.
Next is Erica Blackwell. Erica Blackwell, are you around? I can circle back. Forgive my pronunciation. The next is Oscar.
Thank you. Okay, well, I'm just going to speak. I'm not sure if anyone can hear me or not. I'm not going to repeat all the data that's already been shared with you from the CDC and MDHHS sources, including numbers from just the last week. Let me summarize the data. We have no children in any hospital beds in our healthcare coalition, Region 7. We do not have a shortage of hospital beds or PPE. We have 18 months of research and millions of dollars in public service announcements on how to social distance, get vaccinated, and wash your hands. Do you think we are all stupid? Do we still need the public health officer to tell us how to conduct our lives in the face of the Chinese virus? We are not in imminent danger as worded in the public health code. Here's the ugly who sits on the governor's COVID board, who will not make orders because of the negative impact it will have on our 2022 election, when suburban moms are coming out and never expected. This mass order by U.S. and Michigan constitutions, as previously stated by other speakers, I believe it is time to change the public health code. I believe that this health department board needs to not only look at Lisa Peacock's job, but they also need to look at the environment within the department, as I've heard from many people within, that is hell to work for. I would highly urge this board to not only look into the state of our current health department, but also who is leading it. That's all I have to say. Thank you.
Okay, Erica, we will try again. I'm going to ask to unmute you right now. Okay, Erica, if you would like, we will figure out how to get your public comment on the record. I'm going to move on to the next person, and we will try again after. The next person on our list is Carolyn Zip. Carolyn, I see your mic is unmuted, but we cannot hear you.
Hello, can you hear me now? Okay. My name is Carolyn Zip, and I have 2 high school girls in Ellsworth Community Schools. I am very, very disgusted at the fact that you would pull a Friday night mission to destroy schools and the opportunity these school board members have gone through to set up what you asked them to do. I fully support a couple of the commissioners who called this out and put it in question as to have you rescind this order. The fact is the masks aren't working. You're not requiring adults to wear them. So these kids are coming home and they're around these adults anyway. The other thing, they're going in public. They're hanging out with their friends. They're not wearing masks then. So what difference does it make if they have them at home, at school, out in public? At this point, it is what it is, and we need to just figure out a way to move forward and give everybody the right to make a choice as to what their child needs to do in order to protect them. You keep calling and telling everybody we have to mask up, we have to mask up. Well, as far as I'm concerned, we have masked up, and it hasn't made a bit of difference. Either that or the numbers are just fabricated from who knows where. End of story. It's time that we just let people make the decision for their child. And you stop calling calls at the last minute. That's all I got.
remind people in chat to please keep it civil. Personal attacks and language are not to be tolerated. Next on our list is Ella Nelson.
Hi, can you hear me?
Yes, we can. Thank you.
Okay, first off, before we start, you guys believe in freedom of speech, right? You guys believe in freedom of speech before we start? Because if you do, then you should believe in this. Fuck niggers, fuck you, fuck that, fuck them. I just hate them so fucking much, dude. Like, I've never had so much hate for some fucking, there's such fucking vile people. And they're just walking on the field, so I'm like, just grind my teeth. I just grind my teeth at them with such fucking hate. Like, Jesus Christ, I hate them.
Yeah.
I apologize for not reacting to that quickly enough, guys.
Hang in there, you're doing great. Good job. You got the most stressful job in the room right now.
Yes, he does.
Yeah.
We all just found common ground. Yes.
I apologize for the comments. I tried to limit that quickly. I will do better next time. But again, as a reminder, we are all friends, neighbors, and relatives. Please keep it civil.
They've got no kids are here. There is a kid here. Oh, way to go.
Zoom is completely stopped.
Speaking of civility, going back to Scott's comment, can they go to the website and do a comment? Obviously, it's being hacked here.
All right, unfortunately, didn't want to do it in a particular way. We did receive previous comments to the board. You all received comments that in light of our Zoom meeting is no longer able to handle some of the public comments. I've got 106 for the mask mandate and 12 against. I did ask for a count because I just wanted you guys to know that. Also, don't believe in limiting public comment if they wanted to do it.
Could you repeat those, please?
As of 9 a.m., written public comment cards received prior to the meeting indicated 104 entries for supporting the mask mandate and 12 that were against the mask mandate.
Numbers to be exact.
Let's get some names. See what happens when you take a break. What would you go to sleep at? The shows to submit theirs in writing prior. We don't typically read them prior. We did allow for people to attend Zoom to indicate theirs, just like you had the opportunity to attend in person, they had the opportunity to attend on Zoom. Unfortunately, there's some bad characters. That's not our fault, that's not your fault, it just is bad characters.
Well, how can you just automatically or solely magically have those kind of number sets when we have demonstrated beyond a shadow of a doubt representation?
They really care about to be here.
Compared to.
Yeah, they would.
What it boils down to.
Yeah, exactly.
People take the days off
Names
of
on
work
a
to
piece
be
of
here.
paper, not else in here.
We got those this morning. We haven't had a chance to read them. We got them handed to us this morning. I think we need to.
Opportunity to read those for a moment before we move on.
To read it clearer than.
Your guys'
No, come on.
hang on, everybody. Your guys' Zoom was just hacked. How do we not know that these numbers and names?
Absolutely.
Board of Health. Would you like a moment to review those that were submitted through our public comment card prior to the meeting today?
But who are the people?
Again, how do we verify it?
Just like with voting, we want to know they're actual people and not hackers,
Not
because
a
clearly.
robot.
Clearly it can be hacked. Excuse me.
We don't trust
Let
you.
him speak. Yes, Jared.
I read through a few of them while we were going here, and I know for a fact that a number of them have emailed me personally, so I don't feel like I need more from them. I mean, the comments they submitted were the exact same ones that they emailed me, so I don't feel like I need more of them.
Each of us did receive individual emails as well as emails that went to every board member. Some of those are duplicated, some of them are not. Anybody feel like they need a minute to review the comment card?
No, I'm good.
Okay. We'll close public comment. Please be aware, if there is disruption from the audience, we will suspend the meeting. I don't think anybody wants the meeting suspended. We're trying to conduct business with a respectful effect. Give you the opportunity to speak. I will, public comment is now closed. I will entertain a motion to adopt the agenda as presented.
I would like to make a motion to move item number 6 next in our agenda.
I would second that.
It's been moved and seconded to adopt the agenda with moving item number 6 to prior to staff reports. Is there any discussion?
What we're moving for the public's knowledge here is item number 6 is the discussion on this public health order, and we would be moving staff reports and written reports to a later point in this meeting. And I think it's not only appropriate, but this is the topic of the meeting. Let's be realistic about it. So I think we need to move on with our discussion.
Anyone else have any discussion? Roll call, please.
Rubing,
Yes.
Bargy,
Yes?
Rolla, Hankins,
Yes.
Bachelor,
Yes.
White,
Yes.
Pallarito,
Yes.
Powers.
Yes.
Shirley is absent, motion passes. The item on the agenda is the discussion of the public health order issued on 8/27/21. I want to the agenda has been adopted as presented with the amendment to move item 6 to the first item. Motion passes. Discussion, public health order issue. Lisa Peacock, the health officer, will provide a quick background concerning the issuance of the public health order dated August 27, 2021. Then I will have a brief statement, and then I will be turning it over to the attorney to state, to talk about authority, because that's what I hear, is authority is an issue. So we have referred it to our attorney, and then I will open it up to the health board members individually. You may ask a question. It is for question and answers to either Ms. Peacock or to the attorney. So,
Do I,
go ahead.
Madam Chair, do I understand we may ask a question?
No, I'm allowing more than one question.
Thank you.
But I'm not opening it up for attacks upon individuals. I'm not opening it up for discussion or commentary to that particular, your personal feelings or whatnot. I'm sure you will express those and have. But, Ms. Peacock, if you would like to speak to the order and the background concerning the issue.
Sure, I'd be happy to. So, I just want to start by saying that the purpose of the order that was issued on August 27th is to protect the lives and health of children and school staff. There's no other intention behind that than to do that. We have worked for the last year and a half with our school districts and our school superintendents. Dr. Meyerson and I and our health department team have met every week. We've worked closely together. We've shared guidance, we've shared support, we've problem solved, and we've worked hard together to keep our children safe and in-person learning over the past year and a half. I think that we should all be very proud of what our schools have accomplished during the pandemic. The Northern Michigan schools were a shining light in Michigan compared to a lot of school districts downstate and in other areas that weren't able to ever resume in-person learning. And for anyone who questions whether a quality education is a public health issue, it absolutely is. Finishing your high school education is one of the #1 drivers of future health. And so it is critically important to us that we have the ability to keep our kids safe, healthy, and in school. The decision that we made was not taken lightly in any way. We have reviewed tons of information. Not only the major medical authorities, the CDC, the MDHHS, the American Academy of Pediatrics, who have all urged school districts to adopt policies that align with the CDC guidance of universal masking indoors. I shared with the Board of Health just a packet of letters that were written by our local doctors who care about our children, our hospital systems, our pediatricians, our infectious disease doctors, all written to the schools as they were deliberating these decisions, and to us, urging everyone to adopt policies that would be effective in keeping people safe. We have listened to the public. I have listened to each of you here today, and I know that we are all here because we care about kids. And I know that no matter how we see this issue differently, that is our intention. I have all of the emails and voicemails that I've received in these 2 folders. The green one are people in favor of and supportive of the mask mandate. The red one are people who are opposed to it. The green one happens to be a little larger than the red one. In contrast to some of the other information that was shared today, I think it's important for you to know that. I think it's important for you to know that I read every single one of these emails. I read every single one of these voicemail messages. And I read every single one of the public comment cards that were issued, except for the ones that came in between 6 and 9 o'clock this morning. So I did read all, at the point that I read them, 95 of them last night. I think it was 95. And there were, I believe, 85 supporting the mask mandate and 9 in opposition to it. So I think it's important that we're all clear that there are a lot of parents in our community who are very concerned about the health of their children and sending those children to school when other children aren't masked. Universal masking is supported by science. There were several studies that were undertaken last year. It can be found in the CDC science brief that we shared within the order that supports the use of universal masking as part of a layered prevention strategy. That is what we've been recommending to the schools throughout the planning this summer for the start of this school year. I know lots of superintendents who have shared with me their concern that they weren't able to pass universal masking policies. they have asked us to help them and support them in that process. So as of August 27th, that week, in the preceding couple of days, we also have heard from our health systems. Dr. Meyerson and I have met with our hospital leadership, and the Board of Health knows this, every single week throughout the pandemic, and sometimes more often. There was a point when I was meeting with the hospital leadership every single day at times during this pandemic when it needed to happen. The public health system and the healthcare system function together, and we function together to protect the health of all of you in the community. Public health holds back floodgates of those patients that can overwhelm the medical system. And it's not just about COVID patients, it's about the capacity of our healthcare systems to be able to care for the patients in front of them. That's why they've written these letters. I can tell you that even just today, I received an update, and I'll tell you that the week that we issued the order, on Tuesday, I received a call from one of our county emergency managers who was very concerned about the strain on our local EMS drivers and paramedics and EMS personnel. She was very concerned that hospitals had to close their emergency departments the night before. She was very concerned that patients were having to be transported out of the area to critical care beds that we didn't have available here. And she was very concerned that if that continued to happen, that our EMS, we wouldn't have enough qualified and eligible EMS personnel to safely drive patients to the hospital when they needed to go. That same day, I received a call from the Chief Medical Officer of Munson Healthcare, who said to me that Munson Healthcare had had the most horrific night they had ever had that night. It may not show in the numbers that you see on the state website because those are simply bed counts. They don't take into consideration the staffing shortages that our hospitals have been telling us about week after week after week. That they are short-staffed, just like food facilities, just like retail stores, just like our dental clinics. They're short-staffed, their staff are burnt out, they're frustrated that their beds are filling up with people who are not vaccinated. They are tired. And managing that is a big picture that is, I think, well represented by the Chief Medical Officer of the system. And what she said on that day was that there was one critical care bed available in northern Michigan that day. So I will.
Zero.
McLaren, northern Michigan, I reached out to that week to see how they were doing. And what they told me, and many of our county officials heard the same thing from the time we were on call just this past week, that they have been meeting with the regional healthcare coalitions in Region 7 and 8 over and over again. It's touch and go every single day as to whether or not they have the staff, the beds, the supplies, the medications to treat the patients in front of them. At times they can take transfers from some of our smaller hospitals, at times they cannot. And they have to take those patients that normally would come down here from the UP to be housed at McLaren, northern Michigan, and they're sending those patients to Wisconsin at times. At times, Munson is having to send people down to Beaumont. At times, they can't find drivers. I spoke on Friday with the chief executive at OMH in Gaylord, and he said he needed to transfer a critical care patient, and the day before that, to Beaumont Hospital. He had to try 31 different transporting agencies to find one that had a driver eligible to take that patient downstate. So this is about strain on the healthcare system. It's not about necessarily pediatric strain right now. Because that's
what we're here for.
Point.
Point of order.
Because that hasn't happened yet. We are trying to prevent that from happening. When we talk about ICU bed capacity in northern Michigan, we are talking about adult ICU bed capacity because the pediatric ICU bed capacity in northern Michigan, north of Grand Rapids, is zero. Zero. There are no ICU beds for pediatric patients in northern Michigan, north of Grand Rapids. That is a problem that we are trying to prevent. We are trying to protect our children. We are trying to protect our school staff. I have addressed in my report to the Board of Health the statutory authority under which I issued the order. I have issued previous orders during the pandemic. I have handled it in exactly the same way. You know, the statute, it reads that the health officer immediately shall inform the individuals affected by the imminent danger and issue an order. It doesn't say shall, it doesn't say should, it doesn't say consult with anyone else. It says that you shall. And so in order to meet with the Board of Health to address an issue like that, we have to give 18 hours notice for an open meeting, to comply with the Open Meetings Act. And it is a decision that not only grants the health officer the authority, but also holds the obligation to do something when there is an imminent threat to health, which Dr. Meyerson and I, concurred that there was at that point. The timing of it is critical. So when all of these different elements that I've spoken about were happening in those couple of days before the order was issued, we had a meeting with the school superintendents on Thursday, August 26th. And we spoke with them at length, as we have every week throughout the pandemic. And we let them know that things were changing. We informed them about the strain on the hospital system. We informed them about our increase in cases. We informed them about our concern for kids. We informed them about the medical letters and evidence that had been mounting. We talked about the experience of school districts that had already started in northern Michigan, in other areas of Michigan and out of state, that were seeing rising cases, slowdowns, all of those things, and we let them know that we were taking steps to move forward with the public health order. On Friday, as we worked through that order with our attorneys, there was nothing intentional at all about the timing of the order being released on Friday, other than the intention of getting it into the hands of our school superintendents as soon as possible, because we had schools starting on Monday. And I wanted their kids to be protected. I wanted them to know that they were needing to be in compliance with an order that became effective immediately, because according to the Public Health Code, I have an obligation to do that, to act immediately in the presence of a health threat. So that is the intention behind that. I wish it could have been done earlier in the day. We worked very hard on it all day. And I certainly had nothing to gain from issuing it late. Our school boards and many, I'll tell you, superintendents reached out to me and Dr. Meyerson over that weekend and thanked us for issuing that order, because it made it very clear for them what they needed to do. And they understand how effective masking can be. We also know that we also share the priority of keeping kids in school, learning in person. And when that opportunity to learn in person is disrupted by illness or quarantine, we know how problematic that can be. Lots of information has evolved as the pandemic has unfolded. We know more now about close contact and what that means in a classroom setting. And one of the things that is different this year than last year is that the CDC has recognized through studies that were held focused on classrooms, that in a classroom setting, an indoor classroom setting, where there are strict mitigation measures in place, including universal masking, that students exposed within 3 to 6 feet do not have to quarantine. Their risk of transmission is very low if they are both masked. So my intention is that we can keep kids in school learning, and I will just leave it at that. And Dr. Meyerson, if you want to add anything else, feel free.
For the benefit of the public, rest of the Board of Health, I'll briefly address the open letter issued by 4 members of the board requesting the order to be rescinded. To be clear, there was no Board of Health meeting held to discuss the public health order, nor was I asked for permission or had any authority as chair. I was simply notified that there was a public order being issued, and the rest of the board would get the same notification. The letter was issued by 4 individual members. It is not reflective of any board decision. Just want to make sure everybody's on the same page. There were several comments received that the misconception that it was a board directive or that there was a collective of the board is inaccurate, and I want to be clear to everyone, including the public, that that is not the case. As for authority of issuance of a public health order. I'll turn it over to Mrs. Vogel, the attorney for the Health Department of Northwest Michigan, to address statutory duties and how they are assigned. And then I will call upon membership for questions. Ms. Vogel?
Vogler, thank you.
Oh, I'm
That's
sorry.
all right, That's all right. It's been a long day. I asked Karen to hand out to all of you 333-2451 and 333-2453, both of which are cited in the order that was issued on August 27th. These are statutes passed by the legislature of this state of Michigan, and they are included in Part 24 of the Public Health Code under Article 2 Administration, Part 24 Local Health Department. So first let me give a little background. The health officer position is a statutorily mandated position. The health officer is a public official, defined as a public official in the state of Michigan. With that position, as a statutorily mandated position under the Public Health Code, it has independent duties, authorities, and responsibilities. And one of those is contained in 333-2451. Now, Ms. Peacock did read some of that language, but the operative words for consideration by the Board of Health is the use of the word shall twice in that statute. Shall is not discretionary. It is not a may. So once a determination is made that there is an imminent danger, the health officer shall immediately notify those individuals who are in a position to address the immediate danger and shall issue an order. Now, if anyone has a question of what imminent danger means, it is also defined in that same statute under subparagraph 3A. And in pertinent part, imminent danger means a condition or practice which could reasonably be expected to cause death, disease, or serious physical harm immediately. That practice addressed in this order is the wearing of masks. So there is a link statutorily to a determination of immediate danger in the school setting that compels the public health officer to issue an order. Now, the second statute that was quoted in the order is the epidemic statute. I think all of us hopefully could agree that based on what everyone in this room has endured in the last year and a half, we are still in the middle of a pandemic. And a pandemic is addressed as an epidemic in that statutory authority, 333-2453, wherein it says, if a local health officer determines the control of an epidemic is necessary to protect the public health, the local health officer may issue an emergency order. Now, there's a sentence in this order that says, emergency procedures shall not be limited to this code, which ties immediately into 2451, which I've already covered. So there was overwhelming medical opinion, medical evidence, hundreds of signatures of doctors, hospital administrators that supported the decision was made here. Once that factual evidence and medical opinion was put before the health officer in consultation with the medical director appointed by this Board of Health, they were in the position, and the health officer was compelled by the language of 2451 to issue this order. If any of the Board of Health members has a question about these two particular statutes or the statutory authority granted to the public health officer, I'd be happy to address that.
Certainly. Thank you.
Scott?
So, I've done some research on these statutes as well, Counselor. In 333.2453, to continue with where you were reading, it says the local health officer may issue an emergency order, and it's important to note that it's an emergency order, which I don't believe this was, to prohibit the gathering of people for any purpose and may establish procedures to be followed by persons. I don't believe that that is constitutionally sound, because in our Michigan Constitution, Article 1, Section 3, the people have the right peaceably to assemble. Governments do not have rights. People have rights. Further from our state's constitution, Article 1, Section 1, all political power is inherent in the people. Government is instituted for their equal benefit, security, and protection. To continue from our Michigan Constitution, I believe this is Article 4, Section 1, and I may be wrong there, it might still be under Article 1. Talks about legislative power. Except to the extent limited or abrogated by Article 4, Section 6, or Article 5, Section 2, the legislative power of the state of Michigan is vested in a Senate and a House of Representatives. And the reason that that is very important is Article 4, Section 51 states, the public health and general welfare of the people of the state are hereby declared to be matters of primary public concern. The legislature shall pass suitable laws for the protection and promotion of the public health. What we have here is a person or two persons essentially passing law. And that is not constitutionally sound.
Thank you.
I think we have a microcosm of what took place last year with our governor. And I realize I'm not asking you a question, which you had said. I'm making a statement, so I'll
Well, I
stand.
do want to phrase your comment to a appropriate question. You indicated that.
No, I don't have any further questions for the
But
counselor at this time.
the indication is that the state legislature is responsible for making laws for public health. Correct?
That's what our Constitution states, yes.
Okay, and could you please clarify, is this statute was this passed by legislature?
Yes, it was.
It is a law. It's under the MCL.
But laws get taken
I
against our
understand,
Constitution every day in courts in this
I
state.
want you to understand that we have to, and in this body, this Board of Health, our responsibility was to appoint a duly qualified health officer. We did that. We hired a health officer to comply with the public health. Now, aside of that, that took statutory duties and transferred that to the public health officer. We don't have that jurisdiction under current law. So I want to be clear that we're not debating the law today because that is not our jurisdiction currently. We have to work within the framework that has been given to us. If you so choose to move forward in a different venue, that's okay, but I'm trying to keep it at this level. This is what we have responsibility for.
I understand that. The Board of Health was not involved in any way with this order.
Correct.
You were consulted.
I was not consulted. I
Well,
was notified.
you were contacted. You had the benefit of being contacted where none of the rest of us did.
So I just want to share that the law has been passed by the legislature. The public health code is the law that was passed by the legislature. And I, as the health officer, have duties under that law, that if I don't act when it's the time that I needed to act, I can be held liable for not acting. And that particular part of the statute does not involve the Board of Health. If we were adopting a regulation of some sort, the Board of Health absolutely adopted the sanitary code. If we were going to try to adopt a regulation that required masking in schools, and it was going to be a community ordinance or something like that, then certainly that is not something that I would have a statutory authority or obligation to do by myself. But this, as worded in the public health code, is my role and my obligation to carry out those duties.
So Scott, I'll allow you to, if you have any questions, we'll circle back for comments.
Oh my God. Circle back.
On section 333.2453, says the local health officer may issue an emergency order.
Shall.
Counselor, I know a little bit about the law. Shall means you shall. May means it's an option. Okay. Since our state health department opted not to take a stand, and in fact, Governor Whitmer doubled down on September 2nd and said the best way forward is for local school districts to make their determination. I have a problem with our health department, specifically with our local health officer, making an order. And
I just wanted to add, first of all, that's why I read emergency procedures shall not be limited to this code. In this instance, you cannot read these two particular statutory provisions as being mutually exclusive. They complement one another in the actions that were done and compelled to be done by the duties and authorities assigned to this health officer by the state of Michigan and the statutory authorities that pass these laws. Now, I will also state that every one of you here took an oath of office in conjunction with your election to the local county boards, correct? And that oath of office was that you were swearing to follow the laws of the state of Michigan.
in the Constitution of the state of Michigan.
Correct. The public body that flows from the Constitution of the Constitution of the state of Michigan is the legislative body. And that legislative body down in Lansing are the ones who pass these statutes, making a health officer mandatory for any county or district health department. There are very specific duties, authorities, and responsibilities that are solely laid upon that public official, namely a health officer.
Go ahead, Jared.
Yeah, just listening to this, I'd like to make a motion to rescind the school masking public.
I'll second that motion.
I haven't quite finished yet. I would like to make a motion to rescind the school masking public health order dated August 27, 2021, effective immediately, and to allow parents and school districts to determine masking policies.
Second.
If I may interject.
There's a motion on the floor.
She's not part of the board. We can't talk, she can't talk. She's not part of the board. The motion's on the table.
Point of order, there is a motion on the floor.
Yep, we are governed by Robert's rules.
And if you read Robert's rules,
I did.
there's a motion on the floor.
And It is not on our agenda. There was no prepared motion.
kidding me? We have quorum.
Will be made. How about, I have concerns regarding legal authority to do such a thing. It is not in the board's best interest to move forward on such a motion without getting legal review. So I would like to move it to our attorney for a written legal opinion of the authority for the Board of Health to be able to rescind a health order. We have some liability concerns for this board if in fact you move forward on something that may not be illegal or may not be legal.
Mr. Chairman, Chairwoman, MCL 333.24332F. The board has powers necessary or appropriate to perform the duties and exercise the powers given by the law to the health officer and which are not otherwise prohibited by law.
It is prohibited by law if you try to take a statutory duty from an individual. Now,
They are co-equal partners in this.
this is why I've asked for it to be referred to legal.
You would make a motion to that effect. We need our kids in school.
We want our kids in school. Learning. Not math.
Either that or you can clean up the mess later, just like you do now.
We can circle back on your mistake.
We'll circle back.
Trying to conduct business.
It's an emergency for children, prove that.
Prove it. Right. Prove it.
Prove it.
Prove it.
I was just saying, if you would like to refer it to legal, you can make a motion to do so.
I can refer it without allowing it on the agenda because we did not have it on the agenda.
It is on the
It is on the agenda.
It is on the agenda.
You didn't put it on the agenda?
We are talking about.
Discussion.
Scott, I see you got a.
I'm not an expert in Robert's Rules of Order, but you had a motion made, you had a second. I think you have to proceed.
Move
with
forward.
We got all day.
Don't hide behind Robert.
No, we only have 4 hours.
We're discussing a motion.
Okay.
We are, if and so the chair properly takes that motion up. I have not taken that motion up. It's not on the agenda, it's an action item on the agenda.
We can't hear you.
Purposely did that.
Yeah, literally.
Who created the agenda, Madam Chair?
Make a motion to put
The
that.
agenda was prepared prior to the meeting by the health officer. It was provided to all of you.
Liar.
You were given the opportunity to amend the motion. You did amend the motion to move the discussion up. You need time to properly prepare for a decision. You should want to protect the health department and the health board legally for liability, in my opinion. That is my job, is to look out for the health department and the health board. And if we are willfully asserting a power that we don't have, and in fact are trying to usurp a statutory power, that gets into some consideration.
If I may, so I am here as the attorney for this board. And as the attorney for this board, if you exceed your authority as a board, you could be engaging in willful and wanton misconduct that rises to the level of misfeasance or malfeasance.
Write that down for misfeasance.
So misfeasance and malfeasance are addressed in the penal code, 75478 and 75478A. 478 says willful neglect of duty by public officer or employee or person holding the public trust. A few minutes ago, all of you agreed that you took an oath of office to abide by the laws of the state of Michigan.
More than that law, you're gonna keep smacking people?
Fear tactics talk about how 2451 has an independent statutory authority for the public health officer to issue an order. There are, in my opinion, there is no provision in Part 24 of the Public Health Code that gives the Board of Health any power or ability or duty over the health officer to rescind her order.
Unfortunately, that also means that if we were to move forward in that direction, that only provides more uncertainty within the public, which is which. And so, to make such a motion to that effect, I think is ill-advised of this board without seeking a written legal opinion to allow for the legal authority for this board to move forward on such a motion.
Who would that legal opinion come from, Madam Chair?
It would come from our current legal counsel, which is here
I move to call the question.
Doesn't require a second. I strongly urge you to reconsider and allow for a written legal opinion as to whether or not moving forward with a vote of this nature for an item that is not on the agenda. I will also mention to you that the agenda was voted on and accepted by a roll call vote. Without the addition of a specific motion or resolution that you've just made. So therein lies a procedural issue that I think presents some difficulty, in addition to the legal issues which are very serious and very important to move forward with any action that's been proposed by Chairperson.
Fear.
Sorry.
Fear.
Fear.
Scare them. That's what you're paid to do, is scare them?
I am not trying to frighten anybody.
You are. You are.
I'm telling you what action there. I am telling you what the law is.
Let them make up their minds for themselves. Listen, he got their back when something does happen, so. Let them make up their minds for themselves without threatening.
Legal tyranny.
Do the right thing.
Board of Health's best interest to provide the statutory authority that allows for any rescission of a health order. That is the directive that we are asking for a written opinion on.
From her?
From who? We don't need our attorney. Our attorney Ms. Noble has represented us now for a while.
Guys are stuck as
And
well.
before, on contracts, on legal matters, on labor.
We're done with your opinion. Your advice on the pay.
Unfortunately, she's in this just like the rest of us, but her job is to provide legal representation to the Board of Health and the department, the health department. Yes, Chair.
I think,
But it's based on a law.
Yeah.
I think you've, laid out the ramifications, and I think it's up to each one of us now how we're gonna vote.
Yep.
Do your job.
Madam Chair, if we were to amend our motion to state that we wanted to comply with the guidance provided by the governor and the MDHHS at this point, and maybe this is a question for you, Counselor, that we want to comply with the direction from the MDHHS, which is to allow local school districts to make that decision.
There you go.
Yes.
I'm asking you for legal representation here, counsel, and legal advice. Does that allow us, if we were to change our motion, that the Board of Health wants to comply with the direction from the MDHHS, which is so far to allow local school districts to make their determination. Does that provide us some protection?
The powers of this Board of Health are the following. You can establish programs and services and set fees for what the health department, the district health department does. You can pass regulations which require a 10-day notice and a posting of that regulation that's proposed before it can be put on an agenda or voted by this body. You can establish a budget, and you can engage in decisions that involve administration of the health department. In my opinion, what you're proposing as a amended motion does not fall within any one of those powers of the Board of Health or duties of the Board of Health under Part 24 of the local health department.
So what she says goes and nobody else gets to vote on it?
So whatever Peacock says goes and nobody else.
It is with great concern that the thought is that this public body, albeit elected from the various counties. Elected. Very much so. But the responsibilities are clearly defined in the statutes. Again, this is a public health order that was issued by a statutory created position who has independent powers granted to her by the state of Michigan and the legislature. Defund DHHS.
So if we voted to go against that, are you saying that we're breaking Michigan law?
Correct.
And what kind of ramifications are we talking about?
There are, I will read from the statutes that I mentioned earlier.
You're breaking the Constitution.
When any duty is or shall be enjoined by law upon a public officer or upon any person holding any public trust or employment, every willful neglect to perform such duty where no special provision shall have been made for the punishment of such delinquency constitutes a misdemeanor, punishable by imprisonment for not more than 1 year or a fine of not more than $1,000. So what I'm suggesting to you is this statute has been interpreted under Michigan law as involving three things: misfeasance, malfeasance, and nonfeasance. What I mentioned earlier is if the public health officer has an independent duty and she shall issue a public health order, if she failed to perform her duty in that statute 2451, she would be guilty of nonfeasance.
It's not shall, it's may.
May.
And I will indicate to you. Here we go. Okay. Definition of misfeasance, which is the doing of any lawful act in a wrongful manner. Malfeasance is the doing of a wrongful act in the first place. So, I would suggest that if you knowingly move to make a vote on something that this board doesn't have the power to do in the first place, you would be guilty of misfeasance.
You don't have volunteer women, you have volunteer like.
Statute says that gives us co-equal authority.
There's no emergency with our children.
There's no recruitment.
That is what it needs to be based on.
Come on,
You don't get to just decide.
Scared.
Where's the emergency?
I think you guys need a new attorney.
Yeah.
Yeah, I think so too.
Nobody else has to wear masks.
That's this thing right now.
Nobody has to wear masks.
Drain the swamp. You're forcing schools to bring Michigan law themselves.
At War 51, 1976.
Suspend the meeting. That's your options at this point.
Does the board need to choose to suspend the meeting?
If there has been a breach of peace, we have the right under the Open Meetings Act to stop this meeting. That sheriff, I'm sorry, police officer standing right there will cooperate in documenting a breach of peace, if the properly duly organized body here is not able to continue their business that they're here to do.
We cannot continue with constant interruptions from the public. Public comment is closed. This is the deliberation of this board.
Decision was already made.
I have a question for.
I would direct the Board of Health's attention to 2433, as well as 2441, which is the doctrine of regulations, and the notice of hearing requirements that go with those particular actions, which are set forth in 2442.
I have a question for our health officer. Ms. Peacock, are you willing to rescind the public health order?
There is a provision in that order, so everybody's aware. There is no end date. It is open, so that in the event that Ms. Peacock does choose at a later time that that emergency is not.
And therein lies the problem.
Yep.
Because we all now are subjected to Ms. Peacock's opinion.
Correct.
And not the constitutionally guaranteed right to life, liberty, and pursuit of happiness.
Right.
I'm sorry. I understand malfeasance and misfeasance, and I guess if the sheriff wants to hook me up and take me to the top of the hill, I'm going to do that.
What, if I may ask, what will it take for, for the order to be dropped? What would it take?
Yeah, thank you for asking that. So what it will take is a stabilization of risk trends. So when things are moving in the right direction, the cases that are reported each day, we have no intention of having this be a ending order. I hope that the order maybe can be amended soon to include the addition of some other prevention strategies like testing, like So what we know is that strain on the hospital system, the fact that we have very low vaccination rates in our school-age children and the whole subsection of children who are not able yet to be vaccinated. And many, we're entering school when we're going into a time when we're going to be bringing lots of vaccinated and unvaccinated people indoors together. We start with universal masking. We're starting with the safest option. The best prevention strategy is vaccination. The second best and most important layer of prevention is universal masking. And if we start with it and we see cases going down and it appears that the trends are stabilizing, the hospital systems are able to function, we see we watch what happens in the schools and areas where schools have started before ours, we watch what happens with those pediatric cases, we watch what happens with the trending of pediatric hospitalizations. When Dr. Meyerson and I evaluate that, along with all of our other medical professionals that we work with all the time, to determine that it's safe to remove a layer of the prevention strategy, then we absolutely will. It's just not, it's not as simple as one number or one indicator. It just isn't. It's a complicated picture of risk.
I would add to that, I think that's one thing we put in our order is that we would look at the whole picture. Other orders and other areas were based on just the availability of the vaccine and for school-age children. And I think we both felt that that wasn't really being, true to, evaluating risk. If for whatever reason the case counts go down and stay down, and there's very little community-based transmission, with or without the availability of a vaccine for our youngest, then that might be, if you go back to June, our risk was very low, very little community transmission. You can safely operate in that way. But when we looked at what was going on in the last 2 weeks, the rising rates, the rising pediatric hospitalization rates, the highest they've ever been since the pandemic started, I think this was the safest way to get our kids in school. And just to remind everyone that's one more thing besides what went on there that we all agree on is I think everyone in this room is passionate and wants our kids to be in school in person, and to maximize their chance for the most number of days to just make their education as good as it can be.
Thank you, Bill.
Dave.
Madam Chair, Madam Attorney, if we vote to do away with the health order, does it go away?
In my opinion, no.
So it stays in effect.
Correct.
Based on who?
That's what exposes the health board. If you make a decision that is against that statutory duty, what authority do you have and who will be required? So if you give direction one way and the statutory duty falls with another that gives direction a different way, it doesn't accomplish anything other than confusion. That's not what we want. We want to be clear. If there is authority for this board to rescind the statutory duty, and again, Scott, you asked about the governor or the health, the DHHS. The authority has always laid with the local health departments. I cannot give my clerk statutory duties of election to the treasurer. I cannot do that. I cannot assign a statutory duty that falls within another office to another person. I don't have that power. I don't have that. As governor, she does not have the power. As the state board of health does not have that power, nor can they transfer among. So that's a concern I have in that there's some type of belief that power was transferable among. I do not believe it is. I can direct our attorney to look into that more thoroughly, and then we can reconvene and we can have this discussion. And if you so choose to move forward in that direction, with or without the attorney, answer that you or I think is reasonable, then we can do that. But I don't think it is in the best interest of the community as a whole to move forward on such a motion that would cause confusion without getting the facts before we move forward in any direction into that. Currently, we know that there is the health officer holds that statutory duty. We can all agree on the language that was presented, the opinions that have been written so far, that who holds that statutory duty. Now, as far as our authority to usurp that statutory duty, that has to go through a legal opinion. We should be properly advised. We should receive a written opinion, as well as if there is some way to allow for that, we should know what that way is proper. Otherwise, we all end up in litigation, and it doesn't do the community, again, it doesn't do us good to cause more confusion in light of what our health officer does believe is an eminent threat.
Any one of you can close it.
I have a comment, please.
Yes, Ms. Fox.
I would like to say that I think that much of what has happened today would not have happened had this not been given at 5:30 on a Friday without any direction from your board, which your board has always been included in everything before. And I also resent these citizens being called the peanut gallery.
I regret I regret doing that. I think not only, you know, myself, but that perhaps some other folks today may have said and done some things that they might look back on and think, you know, but nobody's perfect in this setting. We're all trying to accomplish the same goal, which is for everybody to say what they feel and think and what their opinions are. And that's been supported here today. Now again, I meant no harm or malice in using that phrase. It just came off the top of my head as a figure of speech. So that being said,
I apologize that that was unfortunate. It was not intended to be so. But it is my job, quite frankly, to keep an orderly meeting and conduct an orderly meeting. As chair, I've attempted to do that. I've been interrupted numerous times. And people have been respectful as well. So, moving forward, thank you for your comments. Again, Ms. Peacock did issue the order at 5:30 at night. It went out. It was unfortunate timing, but again, school started Monday. The chain of events that occurred compelled her to get it out as soon as she possibly could. Now, we don't get issuance of any cease and desist orders. This board does not have ruling over those either. That's practice. That's how she has the opportunity to do those cease and desist just as much as she has the opportunity to do this public law. So, what I'm suggesting to this board is that we ask for a legal review of the item proposed to see if there is any legal authority given to the Board of Health to usurp a statutory duty provided by the health code to the health officer. That's what we need answered. We need to find out if there is any such authority that we can then move forward.
Counselor, you and I haven't even officially been introduced. I'm Scott Haynes. Nice to meet you.
Scott.
I think that you can get any legal opinion that you want. I think that the law, somebody made the comment earlier today that 50% of the lawyers lose every day in court. And they're right. It's been suggested that I propose a vote of no confidence. And I've said this prior to this meeting, it is not my goal to terminate Lisa Peacock. It's not my goal to pursue that course of action. I think that Ms. Vogler probably was consulted prior to this order being instructed, or that she may have helped to put that order together. I don't know if that's true or not.
Jim Young, are you familiar with Jim Young?
I do know Jim Young.
Jim Young, because of his experience over the last year and a half through the pandemic, working with Lisa Peacock and Dr. Myerson, took the lead on Dr. Young.
Okay, thank you. I would also say that we're damned if we do and damned if we don't, because we're going to wind up in court one way or the other. And what we do all have a shared interest in is our children being in school. I think we all have a shared interest in the health and welfare of children. How we get there is where we fall apart. And this pandemic has done nothing but divide people and divide families for that matter. And it's heartbreaking. I had 2.5 pages worth of questions that I wanted to ask you, Lisa, to be frank. But I think a lot of them have been addressed in one way or the other today. Council, if we were to propose a vote of no confidence in our health officer, what does that do? And like I said to you before we resumed the meeting, this is nothing personal. This is because I like you personally. I thought you shared a great story about your son passing out at his wedding. That I still laugh about that, okay? But what would that do for us?
To my knowledge and understanding, there is no such thing under Robert's rules as a vote of no confidence. It does not exist under Robert's rules. And the bylaws for this board have adopted Robert's rules. So, looking at review these. Yes, under meeting section of the Northwest Michigan Community Health Agency Board of Health bylaws and rules of order, it states meetings of the board will be conducted in accordance with the Michigan Open Meetings Act and will follow the guidelines of Robert's Rules of Order.
Thank you.
Since you're under Robert's Rules of Order, you still have a motion on the floor, unamended and seconded.
Chair has not taken up such a motion in Robert's rules. I will, but I will ask the attorney, because this is going to be your next question, I'm sure, is termination.
Correct, yeah.
And so, again, there may be legal ramifications and liability. I'm going to refer to our attorney for direction, and if needed, to direct the attorney to prepare a written opinion to be considered by the entire board at a subsequent meeting. I will follow to you, but I do want to, I mean, I'm guessing that that's the next course if you're looking for removal.
I'll restate, that is not my thought process, honestly. But to that end, do we have, well,
would a removal of office not be in line with the termination of an employee?
well, we appoint the health officer, is that correct?
Correct.
Um,
And we have a job description that goes with it,
okay.
and a contract, which you have a copy of as well. We actually have several contracts that are tie-barred together.
No, that wasn't my next question, but that's okay. My wife can't read my mind either.
And to be fair, quite frankly, your comment, we're going to get this one way or another. The proper way, because this board doesn't have the statutory authority, it therefore would have to be something, I believe, introduced in court for the court to decide whether that can be rescinded or not if you choose not to follow attorney opinion. But quite frankly, causing confusion, if we're going to end up there, maybe that's the best place for it to end up.
So while it is true under MCL 333-24282, the health officer acts as the administrative officer of the board and can take actions and make necessary determinations necessary or appropriate to carry out the functions of the Health Department Northwest and the board. It is also true pursuant to MCL 333.24332F. The board has powers necessary or appropriate to perform the duties and exercise the powers given by law to the health officer.
Yeah. On that one. However, we haven't appointed health officers, so then I'm gonna circle back to, termination.
Well, is it your position then that we have no authority over our local health officer?
Pretty much, yeah.
Pretty much.
Yeah. We have the authority to appoint, much like your soil erosion or your inspector, your building inspector. Once that person is appointed, the board can't say, no, your house, no, never mind the inspector, that house is good. That's unfortunate but I'm using it as an analogy because that's where we sit today. She had the authority, we gave her the authority to remove that authority or to remove the health officer, then gets into a retaliatory, it's usurping of the, I get back to the statutory. My concern is the statutory responsibilities held by the health officer. And we, as a body and as local officials, need to abide by state law. And so that's where the conundrum in here lies. I'm not advocating for one way or the other. I'm trying to make sure that this board is doing due diligence to make sure that they're doing their responsibilities properly. That's what I'm asking of this board. And I think that the responsible thing to do is to turn it over for a written opinion. If you would like a second attorney, we have Jim Young, who has been our attorney for many, many, many years. I can refer it to Mr. Young for legal research if that appeases the board. We can reconvene. I'm not saying that this is indefinite. I'm saying we can reconvene for a special meeting. But I think it's important that you know what your responsibilities are in this matter and how it would affect the health board, the health department, the health officer, and those statutory duties. I am specifically looking at statutory duties as assigned by this board. And then when we talk removal of office, that, I'm sorry, but I believe that looks at a termination issue as well, because we would have to, the contract is for the health officer. And so we would need to know what that entails as well. Yes, Jared?
You know, it wasn't my intention to get rid of Lisa either, because I don't care which thing in life you work in, sometimes you get people that are a little overzealous. And you gotta correct them and channel them and get them to go the right way. That's all this is. This isn't. And if it's malfeasance to listen to the people, I'll be in jail right behind Scott.
Yeah!
Work for us.
It is in Robert's Rules of Order, and when there's a motion and a second, there will be a vote taken. Here.
Vote.
think it's interesting to note, thinking on it, that this whole country is set up as a democracy, that the people come first, and we work for the people. And I think George Washington said that when we cease to work for the people, then the democracy is over. Now think about my kids. That's the reason I signed up to run for government, because I care about them. I wanted them to have the opportunity to live in a land that's free, not listed by rules and regulations. I got relatives who went and fought for that.
Amen. Yeah.
Not anymore. Well, Scott, if anybody knows what the jail's like, I guess it's you.
We'll put money in your account.
It's not my,
We will bail you out.
it's not my first choice of accommodations.
Should you really be running Robert's rules if you can't recite it off the top?
Correct.
Yeah.
Come on, Scott. Use the Robert's rules and know your goal.
We got a motion, we got support.
My job is to abide by Robert's rules, that's what our bylaws indicate. The motion does not come before the assembly without being acknowledged or read by the chair unless properly on the agenda. It was not properly on the agenda, that's where my conundrum is. It also has legal implications that puts us more in harm's way, quite frankly.
Can we then, make a motion to amend our agenda again?
Yes.
And
Yes.
add this point to our agenda?
We have already adopted the agenda.
Affirmative vote to adopt an agenda may not be reconsidered.
I'm not asking to, I'm asking if we can amend our agenda.
Where did you find that?
You got Mark in the book. Yeah.
So, Robert's rules indicates an affirmative vote to adopt an agenda that may not be reconsidered, since we've already considered and adopted.
May not.
It indicates that it is not a vote for reconsideration.
So my understanding from what you replied to here, Madam Chair, is that we can't vote on this motion unless you recognize it.
Or we put it on a properly noticed agenda as an action item to rescind.
If the chair, according to Robert's rules, does not mention a motion, then you can appeal the decision of the chair.
And where is that under the appeal?
By voice vote.
Yes, voice vote.
Yes. Vision of the House.
So I guess if you are not recognizing the motion, then I will make a motion to appeal require a division of the board. State whether the motion is valid or not.
And from what you're referencing, do you know if that requires a majority or a 2/3 vote?
Requires a majority vote of require a division of the board for an appeal of the chair. To appeal a decision of the chair.
Does that take into account that Ms. Ruloff was here at the start of the meeting and is now absent?
No, because she didn't vote on the agenda.
You tried everything, right?
Yeah. Just make a decision.
Simply raising pertinent issues for
Yep.
consideration.
So your.
That's here by 2/3 vote, you can change
Your
the agenda.
motion is to appeal the decision of the board chair by division of the board.
Correct.
Is there a second to that appeal?
Yes.
It has been moved and seconded to appeal the decision of the board chair by division of the board. Roll call, please. I'm sorry, is there any further discussion? Hearing none, roll call, please.
Rubing,
Yes.
Bargy,
No?
Hankins,
Yes.
Bachelor,
Yes.
White,
No.
Calorito,
Yes.
Howard.
Yes.
Motion passes. The appeal to allow for the rescind motion of the health order will be allowed by division of the board. Thereby, the first motion of Jairus, seconded by Dave Batchelor, was a motion to, I'm sorry.
Rob Kelly.
Rob.
Yeah, I
Second by
second
Rob.
the original. Wrong vote.
You restate the motion.
To rescind motion to direct, well, I guess I'm gonna ask you, do you want to direct the health officer, or do you want to motion to rescind? Your motion was to rescind the health order.
I'll read my motion again. I make a motion to rescind the school masking public health order dated August 27, 2021, effective immediately, and to allow parents and school districts to determine masking policies.
It's been moved and seconded, motion to rescind the health order dated August 28, 2021, effective immediately, and to allow school boards to determine. Parents and school boards to determine masking policies, correct? Is there discussion? Mr. Well, I'll go with first Dave over here.
Oh. So whether it's voted on to rescind or not, if it is voted on that it to be rescinded, what happens then?
The mask, as we understand it, if I understand you correctly, the mask order remains in effect, because it is a public health order of which you have no statutory.
At least you all go on record as
So we're voting
supporting.
essentially for nothing.
Well,
No, you're going on record.
I don't know the lady's name, but she makes a valid point. We're making a public statement that we're in opposition to that. That
And on the
order.
school boards, they'll have the freedom to do that too.
In opposition would have been, we are in opposition of
Of the mask mandate.
the mask mandate ordered by the health order of Ms. Peacock. What you are asking for in a rescission of that order is something you don't have the authority to do so. However, it will be conveyed as a rescission of the order by those individuals who so read it that way, because that's what it's meant to do, is to indicate that we are rescinding it, although we have no authority to do so. don't have any other legal opinion to go on at this point. We've asked for written and the board chose to appeal that decision. So, Mr. White?
Mr. Batchelor asked my question. I represent Petoskey. They've already voted a mask mandate at the board level, so we can have this.
Not saying France.
We can have this move, but for the people I represent in Emmett County, they've already voted for a mask mandate at the school. At the school board. The school board did, that was elected.
The Petoskey School Board did
That's
not.
what I said. The school board I represent, which is Petoskey.
But you have a Lansing, you have.
Harbor Springs.
Harbor Springs, you have several school districts in your county, sir.
That's why we haven't, I'm not gonna speak for Ms. Peacock, but she has stated that a universal masking mandate, because of the layers and the confusion in the districts. I will tell you, we move forward on our decision, there will be confusion. There will be, it just will be. And you may be violating the law. And for me, I would not violate the law personally, that I've been notified that I may be, I'm choosing not to. That's my concern for this entire board.
I'm also concerned about that part.
I think that the laws that have been cited can be argued against our state constitution in court. I believe that's where we're headed. And, Counselor, you know that laws get measured against the Constitution on a daily basis. And I don't know if these particular public health codes have been taken to that level, but I think that's where we need to go. And honestly, this has been very educational in that our Board of Health has absolutely no authority to direct our health officer.
Correct. Right.
I don't know how we get there or how we amend that or how we correct that, but that's what we're elected to do, is provide direction to our health department. And you're telling me that we have no authority to do so.
Just so you understand, one of your roles and duties and responsibilities is selecting the health officer. Selecting the health officer, doing so recognizing that that public official, the name of the health officer that this body chose and entered into a contract with, has independent statutory authority and duties. So you would have known that when you hired her. Well,
not me.
Okay.
I got elected in November of last year.
I can tell you, prior board, all knew that. We've had numerous trainings on what that health order and what those duties are. I've been on the board for 10 years.
I get it, but 4 of your members are brand new this year.
Understood. Understood. But it's not that this was, you were new to the board, but that's not new to the public health code is what I'm trying to.
Well, then it needs to be changed.
Okay.
Yeah, we're gonna take your powers away.
I'm sure.
I wouldn't wanna speculate on how the courts might rule, but as a general matter, there are general, let's call them police powers that are granted by our state constitution. And those general police powers kind of flow down from the Constitution to the laws that the legislature enacts. And considering those police powers and how they can help our communities, one of the roles for that, and I'm using it very generally, is police powers. Health, safety, and welfare are generally considered to be part of the police powers. End up in statutes much like the one in the public health code that allows someone who has the education and the experience and the qualifications, which as a Board of Health, you're required to assess the medical director and the public health officer's qualifications for the position that you vote to appoint her into. So in considering all those together, if you're taking issue with anything, you're taking issue with the wording of the statute and the authority granted by the statute, which is in fact a legislative role. If the public as a whole doesn't like the wording of the statute or how it's implemented, then that starts with the legislature and hopefully doesn't end up in the court system. Because the court system doesn't write laws. They interpret laws.
So to put that in layman's terms, if I understand you correctly, Counselor, if we as a Board of Health disagree with the actions taken by our local health officer, the only option we have is termination.
In my opinion, yes.
Please be aware that, and we're going to talk about termination now, in that there are some ramifications and liability. Again, we're going back to statutory duties. If in fact there's been a statutory duty assigned to an office, and they have done their statutory duty, and you terminate based on them complying with the law, what liability therein lies with you. Same thing if the health officer were not to comply with her statutory duties, she would be held accountable as well. I'll go back to I'll pick on the clerks because they love being picked on in selections, but if in fact the clerk chose not to do her statutory duty as it's spelled out, there are some, that's against her statutory duty, right? She has to comply. If in fact she carries out the elections and you don't want her to carry out elections, we would be in violation if we were to stop an election. So again, we may be interfering with the statutory duty by termination, because essentially if they comply with their statutory duty and we terminate it as a result of complying with that statutory duty, we may be culpable. Now, I'm just putting it out there so everybody's on the same page. I want you to understand that this is not an easy subject, but we keep coming back to that statutory duty, and we do need to comply with the law and what the law says. And as far as we are understanding, and as what our attorney has advised so far, statutory duties are law made by legislature, guided by Constitution. So those things that you are worried about, yes, we have them in law. They've been in law. I don't know how else to.
I don't know that the public health code was guided by the Constitution, because it grants the authority of local health officers to prohibit the gathering of people. Our Constitution grants the authority to people. Yeah. Again, governments don't have rights, people have rights.
I think that, Scott, as I look at that statute, I think you have to take the whole statute in context. And I think the context of the not gathering may refer to pandemic setting from 2453. And that the health officer may prevent the gatherings for purposes of containing and not further spreading an epidemic. I think that all statutes, need to be read in the context in which they were drafted. And again, that last sentence says that emergency powers are not limited by this provision. So I understand what you're saying. We all have a constitutional right to gather, as these folks did here today. They gathered, they spoke their minds and their concerns, and we all recognize that's an important part of democracy.
Now take that context and apply it to what she just did.
That's why we're here. I want to address for a minute what Karen, Madam Chair, was trying to state. And there's different contracts at issue here with the appointment of the health officer. there's a contract of this board, and then there's a contract with Benzie Leelanau District Health Department, whereby you share a health officer, share the expenses and share that health officer. I will tell you that I looked at those contracts, and I believe the contract with this board has a 60-day provision in it as far as termination. It also has notice provisions in it. The Benzie Leelanau District professional services agreement has a 180-day notice provision in it. So there's different levels of contractual consideration that go along with the termination. Now, in the agreement with Northwest that I've reviewed that Ms. Peacock has, I will state for the informational purposes of this board that when someone has an independent statutory duty that they perform, and that duty is part of, can be considered a public policy goal, the achievement of public policy. In a public health setting, I certainly would think performing what is said to be a public health concern and implementing that would be part of public policy. There is Michigan Supreme Court law that I have in front of me that says even if that person who performed that role, that statutory duty, was considered to be at will, you may not terminate them arbitrarily and capriciously for the performance of that statutory duty.
So that was going to lead to one of my next questions is, in her employment contract, does she serve at the will of the Board of Health?
Yeah. I believe she does.
Pretty much so.
I will state that these contracts there's a separate one for the medical director, and there is one that pertains to the health officer. I'm looking for that. I'm sorry, I can't read close up with those on. Yes, this is the employment contract between the Health Department of Northwest Michigan and Lisa Peacock. And the provision, paragraph number 4, says this employee is at will. And I'll give you maybe an analogy that some of us would recognize more, which is the whistleblower statute. There's an analogy between the Michigan Supreme Court case I mentioned that talks about terminating an at-will employee, but yet that person was, becoming forthcoming about a violation of law. Same analogy here with a public official performing a statutorily mandated duty, even though that person holds their position at will. It would be a violation of public policy to terminate. So.
And again, that's not my goal at all.
I understand.
I'm just trying to understand all of the legal ramifications of this.
Any one of you at any point in time, any one of the board members here has the ability to pose a question for legal written opinion.
I didn't know you existed until today, I'm sorry.
There we go.
I think it goes for most of the board.
Jim Young would have accepted that question or concern and would have addressed it with or without consulting me. But Jim has been an attorney for this board for Lisa 30 plus years. Yeah. So,
can we please not speak on Jim's behalf? He's not here.
So any one of you can pose a question or concern at any point in time. It would be addressed in a written legal.
This is why she was invited to this meeting, because I anticipated that there would be some legal questions that the board would have to contend with. We don't typically have hot button issues such as this. I would say we have not had as many in public. Usually I have public comment as one person, maybe. So it does pose a challenge to this board, though.
I have a question, Karen. In a nutshell, we either withdraw the motion and go along with what the health officer did, or we risk going to jail. In a nutshell, is that it?
That's a nutshell, a peanut shell.
Well, okay,
I don't think,
let me respond to that. I've put a lot of people in jail in the last 37 years. I don't think anybody on this board is going to jail regardless of how.
If our opinion or our vote doesn't matter, then it doesn't matter. I mean, whichever way we vote.
I think it is a valid point to, even if it's symbolic, I think we make the vote that we're going to make.
Yes.
And like somebody in the crowd said, we go on record.
That's right.
And so I guess, Madam Chair, at 6.5 hours with a 15-minute potty break, I'm gonna call the question. Let's vote.
The motion has been made and seconded. It is against the legal opinion of our ward attorney to move forward in such a manner. I do want everybody to understand that. It is a statutory duty that you are looking to revoke. By rescinding the order, it will not and cannot be used to overturn the current public health order. That will stand for statute. I understand the symbolic that you wish to do. Unfortunately, I think it's going to cause confusion to do it with that wording.
We're not dumb. We're not confused.
That is insert the board. Roll call, please.
Rubin,
I could not be prouder to vote yes.
Harvey,
No?
Hankins,
Yes.
Bachelor,
Yes.
White,
Yes.
Palorito,
Yes.
Powers,
Yes.
Motion passes, one absent. Thank you, guys.
Thank you, guys.
We have 30 minutes to complete business. Moving forward on the agenda, which is now staff report from the health officer. We're going to
Okay. The first item in my report. Okay, Lauren, if you're exiting, the first item in my report is the budget memo that were attached. So I'm going to hand that over to
there was a recommendation to provide personnel and finance to approve the 2021 revised amended budget of $30,209,275 at the functional level. Do I have a motion to that effect?
So moved. Seconded. Palorito.
White, Dave White.
Dave White. Palorito.
First and my second, is there any discussion or questions there is available? Going once. Twice. Roll call, please.
Rubin,
Yes.
Harvey,
Yes?
Hankins,
Yes.
Bachelor,
Yes.
White,
Yes.
Valerito,
Yes?
Powers.
Yes.
Motion passes, one absent. Next item on the agenda is to approve the 2022 initial budget of $28,366,022 at the functional level. Is there a motion to that effect as recommended by the Personnel and Finance?
So moved. Powers.
Support.
It's been moved and seconded. Is there any questions or discussion? Jerry again is available for your input. Is that a yay or nay? Nothing.
I just got this Friday. I mean, I've not had an opportunity.
You were working on something else.
My phone's been blowing up.
I think, Terry, you pretty much, it's to get to a functional level, and there's still a lot of input yet to go into the report, correct?
We will be adopting the budget. This is an initial budget. As always, there are changes to the budget, there are amendments to the budget based on what grants we do receive. We write grants requests all the time. In addition, it was a reduction to equipment line item for environmental services because they have completed that build out of the regional lab. So you'll see that there was an increase. We got a grant for environmental services for water surveillance. So that was one that has a big jump from previous years. The temporary employees for community and family health, our salaries and wages are reduced only because we don't know what response will be needed in the future. But current levels are what we are anticipating, given the last year, and where we were high, low, and kind of tapering. So we're only budgeting for what we anticipate at this point. If there is a surge in a need, then it will be amended to accommodate for to take care of that need. We certainly saw, I can speak to Antrim County, that was one, environmental health, where we saw a huge surge in Bel Air. And so the health department was made aware of that there was more help needed to answer the phone. They put a person there. So that type of stuff happens on a regular basis. That's the management behind the scenes, if you will. We have to approve the budget just like we do for the board. And then as amendments come forth, that will be presented for adoption just like we did last year. Is there any other concerns or items that you would like more information on?
I'm always available if you have follow-up questions afterwards.
Thanks, Jerry.
Any further discussion? Hearing none, roll call please.
Rubing.
Yes.
Cargy.
Yes.
Hankins.
Yes.
Bachelor.
Yes.
White.
Yes.
Valerito.
Yes.
Powers.
Yes.
Motion passes. Next item is a resolution.
Yeah, the next item in my report, the final item in my report that hasn't yet been discussed is a retirement resolution. We have just recently experienced the retirement of Dan Powers, who is our longtime IT manager. And so in keeping with normal pattern, I will read the resolution and we are asking that you adopt it. In an official session, on September 7th, 2021, the following resolution was unanimously approved by the Health Department of Northwest Michigan Board of Health. Whereas Dan Powers has provided over 22 years of service at the Health Department of Northwest Michigan as Information Technology Supervisor. Whereas Dan's professional, dedicated, and focused work ethic has been an asset to the agency and the clients and communities we serve, supporting the delivery of programs and services to thousands of residents of Antrim, Charlevoix, Emmett, and Otsego counties. Whereas Dan's desire to assist those in need of service extended across all divisions of the health department, providing backbone services to all staff, dental clinics north, as well as providing leadership for health department partners across the northern Michigan region. Whereas Whereas Dan's leadership within the agency facilitated an overarching philosophy that promoted partnership between programmatic needs and IT support with a clear goal of supporting users so that they could in turn serve the public, helping to facilitate access to IT services and the provision of skilled and friendly service to all of our customers. Whereas while functioning in the role of IT supervisor, Dan provided leadership, mentoring, and guidance to staff reporting to him, advocating for support and resources that would foster their success in providing direction, explanation, and support to our divisional end users. Whereas Dan's knowledge of network operations and security ensured that the agency was protected from threats, ensured continuity of operations, as well as ensured policies and procedures were up to date, HIPAA compliance was adhered to, and security for all of our critical systems was in place. Whereas Dan served as an important voice with the agency administration regarding the IT needs of the health department, and in the course of doing so, developed and implemented policies and processes that increased efficiencies in IT service delivery and was instrumental in maintaining software and hardware systems necessary for all health department employees to provide our communities with valuable services. Whereas Dan's project management skills, financial accountability, and attention to detail ensured IT projects were completed on time and came in at or under budget. Whereas Dan's commitment to and belief in the Health Department of Northwest Michigan's mission included his unwavering support to coworkers, supervisors, and vendors. Whereas Dan's exceptional organizational abilities and commitment to agency excellence was evident in the leadership he provided. Therefore, be it resolved that the Board of Health commends Dan Powers for his service and dedication, and on behalf of the department, its employees, and the people it serves, indicates its appreciation and says thank you. And be it further resolved that the Board of Health extends best wishes to Dan Powers for a long and happy retirement.
Is there a motion to adopt the retirement resolution of Dan Powers as presented?
I'll make that motion.
I'll second.
Is there any further discussion? We wish well to Mr. Powers. Regretful that it is in this meeting that he chose to retire. But please know that it is recognized the hard work that it took him to get to retirement, and we appreciate that. Any further discussion? Roll call, please.
Rubing,
Yes.
Bargy,
Yes.
Hankins,
Yes.
Bachelor,
Yes.
White,
Yes.
Valerino,
Yes.
Howard.
Yes.
Motion passes. Next item on the agenda are staff reports. Our written submission, the community health director and deputy health officer and the school impact reports and confidentiality and consent clause. Were there any questions or concerns regarding the report? Hearing none, thank you both for submitting. The family health director submitted a report regarding family planning. Were there any questions or concerns regarding family planning? Thank you, Ms. Thompson, for submitting. Environmental Health Services Director had a report on on-site wastewater violations and enforcement policies. Is there any discussion, questions, or concerns? Hearing none, thank you, Ms. Burrell. Regional Planning Director is not present. She had a behavioral health initiative update. Are there any questions that need to be relayed? Not seeing or hearing any, thank you to her for submitting. Medical Director gave you a report regarding the review of sexually transmitted STIs and communicable disease report. Were there any questions for either of those reports? none, thank you for your report, Dr. Myers. The public health order issue has already been discussed. There is a personnel and finance committee recommendation for August expenditures of $652,851.04 and employee expenditures of $14,891.99. Is there a motion to approve as presented?
So moved.
Seconded, Alvarado.
It's been moved and seconded to approve August bills. Any further discussion or questions? Hearing none, roll call please.
Rubin.
Yes.
Bargy.
Yes?
Hankins.
Yes.
Bachelor.
Yes.
White.
Yes.
Colorado.
Yes.
Howard.
Yes.
Unfinished business. We now have the question how to move forward, both for the Board of Health and for the health officer. I'm going to pose that question to legal for recommendation, written opinion. We are still going to get a written opinion regarding statutory duties and how that applies to her health order. And we'll take it from there, I guess, unless there's another suggestion. Please note that the health officer still has opportunity to confer with legal in her official capacity, and she should do so, because she is again representing the health department as the health officer. And that is an appointed position which she still carries, so she does have that authority to confer with legal to talk about the motion by this board. Also, directing the statutory, so we're clear on the direction. Any other unfinished business to come before the board? We stand adjourned, thank you.